My name is Kim Tate-Grain. I am the coordinator for ACOVA.
My name is Heather Cody, assistant coordinator for ACOVA.
And I am Heather Moran. I'm also the assistant coordinator.
ACOVA stands for a community organization for victims assistance. So we serve all kinds of victims in the Pueblo community, in the whole Pueblo County, all the way to Beulah, Rye, Colorado City, anywhere in Pueblo County.
We do a lot of crisis intervention, so trauma-informed care. We go to drownings, natural deaths, fires, burglaries, robberies. Sometimes they'll just call us out if someone's having a mental issue. So we provide support to everybody and anybody.
Anything that is somebody's worst day, going through a trauma, they call us out to offer resources. Tanya Johnson approached us a couple of years ago, or maybe a year ago, and asked us if we would consider being a host site. People that volunteer or work with ACOVA are very empathetic people, and it's really hard not to take that on. Many of our victims don't have the resources for mental health care. And even if they could afford it, which most of them can't, transportation's a barrier, childcare. There are just so many barriers that so many of ours would not have an opportunity to get that care if it wasn't for Pueblo Mental Wellness.
They've been great. Our volunteers and even, us, we've been through our own trauma. Some of us have been victims as well. If we show up to something that we've been through before, it can be very hard.
And even though we can debrief with each other, we are still, we're not clinicians. So we might not always have the right tools. Sometimes we don't want everybody to know that we had a hard time dealing with that or something. So it's just a really good resource on so many levels. We did have a volunteer. She was very young, went on a really hard call, didn't really know what to do with all the heaviness when she completed the call. And she was able to call that resource therapist who is with our host site. And she loved him, and continued to see him for some time. Not just we give you somebody to say we gave you somebody. They find someone that can serve you.
I feel like the response in the community has just been overwhelming. Like when we offer this resource to them, they're like, I had no idea that this was available to me. And this can be at your fingertips, somebody that you can talk to immediately. It's just a sigh of relief for these victims. It really, really is.
So they offer telehealth, and they really try to work around that person's schedule and things like that. So just the part where they can do it over the computer or over the phone or all that, and just making it real accessible to those clients. So many people out there would not have anybody to talk to if this service wasn't available. We've always been able to get our clients in or our victims in right away.
You don't have to do anything. They'll call you and they'll work out a time that's good for you, and they love that. It's a lot easier.
There is still a mental health stigma, and then a lot of people don't like to come out of their homes or ask for help or think that they can handle these traumas on their own. And so for a program to come and be available to them, to access it in the safety of their home, in their own privacy, something that they don't have to travel to, it just makes it so much better for them.
We're always looking for advocates.
We need volunteers.
We need volunteers.
Volunteers.
Yes. We have access to free therapy.
Don't have to bring any skills. We teach you what you need to know. All you got to have is a big heart and a willingness to serve. But I would just say we're just so grateful for the program. It's very easy to get the referrals done. Our victims don't have to wait, and they're so grateful.